Hi, I'm Robert Morgan. I'm a nurse practitioner from Kingwood Health and Wellness, and I'm here to discuss hypothyroidism and the complications of low thyroid levels. Hypothyroidism is when the body doesn't make enough thyroid, but the big debate in medicine is when is it not enough? Whenever you have symptoms, your levels are too low. We all go to a doctor or nurse practitioner whenever we have symptoms. We do not go because of our blood work. We go because we do not feel right. This is a big topic, so for today, I just want to mention some of the complications of having a low thyroid level. We will have symptoms such as weight gain, fatigue, depression, poor concentration, slow bowels or constipation. We may get cold easy, have cold hands or feet, our hair starts to thin, our skin gets dry. We don't sleep as well as we used to. We may feel tired all the time or wake up tired. Bone and joint pain may be present. Sounds like we're getting older, right? Well, here are a few other complications, such as high cholesterol and triglyceride levels. Elevated prolactin levels, which a lot of times are present, can cause impotence in men. You know, the dreaded erectile dysfunction. High prolactin levels can also cause menstrual irregularities in women, and even lactation. Rheumatoid arthritis and other autoimmune diseases are linked to low thyroid levels. It is also having an effect on our blood pressure, in particular the diastolic blood pressure, where we many times see diastolic hypertension, which is caused from an increase in arterial stiffness. And according to the Journal of Clinical Endocrinology, this increase in central arterial stiffness increases our risk of cardiovascular disease. The Journal of American Medical Association, or JAMA as we like to call it, even reported that the risk of coronary heart disease and mortality increased with hypothyroidism. In the Annals of Thoracic Surgery, which is one of those cardiac surgeon journals, it was reported that low thyroid levels put patients at a higher risk of atrial fibrillation after having cardiovascular surgery. And for women who are wanting to have children, low thyroid levels are associated with an increased risk of miscarriage and premature deliveries. In yet another journal called Circulation, which is a journal for cardiologists, it was reported that arterial compliance is reduced in hypothyroidism. This leads to an increased systemic vascular resistance. There is also a reduction in nitric oxide availability and a rise in diastolic blood pressure. So you have all of these cardiology magazines showing studies that low thyroid levels can cause a lot of problems. The journal Circulation also reported that there was an apparent increase in the risk of strokes and prolonged QT intervals, which predispose patients to ventricular irritability. Cross-sectional studies demonstrated that approximately 30% of patients with congestive heart failure have low thyroid levels. In 2017, the Journal of Cardiology found that treating low thyroid levels actually decreased the risk of death in women with atrial fib, and that treatment with thyroid replacement could be beneficial. But wait, it gets better. Because the Journal Psychology Today, it was reported that low thyroid levels are usually underlying with depression, and that treating patients with thyroid is a successful long-term treatment of major depression. This goes on and on. So my question is, why would we treat low thyroid? In medical school, it's taught to not look at the thyroid levels, but to look at a pituitary hormone called the TSH. And for this very reason, your family doctor, your OB-GYN, and even your endocrinologist will try to tell you that your thyroid levels are in the normal range, despite you having symptoms, despite your levels being on the very low end of the range, and putting you at risk for all the above mentioned medical problems. However, instead of treating you with thyroid, they can treat your high blood pressure. They can treat your depression. They can even treat your cholesterol levels, which, by the way, the celastatin drugs last year was over $1 trillion. So in 2019, $1 trillion. So why would they want to be more aggressive and treat something as simple as low thyroid levels? That is something you'll have to ask yourself. But I am well versed and trained in thyroid replacement and have devoted the last 17 years of my 27-year career to improving the quality of life of my clients. If you're symptomatic, and you want to have an evaluation, you have my number. I will be following up with many more short videos on low thyroid and treatment, so stay tuned and please like and subscribe to our YouTube. God bless you. Have a good day.